He covers a lot of these kind of questions on emergencies in movement disorders. Diagnostic workup in movement disorder. Again, it's a very broad question, but generally speaking, the way we have solved it is that we have two panels. We have a movement disorder panel 1 and a movement disorder panel 2. We do movement disorder panel 1 on everyone who we see for movement disorders. And we do movement disorder panel 2 selected items from panel 2 on certain patients. So that's an easy way to start with. I think I have added those in the resources in Google Drive, that link I've shared. Look for movement disorder panels. It's a PDF. There's a panel 1, there's panel 2. Panel 2 is very broad. So you don't do the whole panel 2, you select from panel 2. And panel 1 is narrow, and you do panel 1 on everyone. So for movement disorders. So that would be a good way to start. Genetic testing. So for genetic testing, I'm a strong believer on doing a broadest panel possible. So for example, when I'm doing an ataxia testing, genetic testing, I have this panel that I do, which is called comprehensive ataxia panel. And it's, I think, more than 110 or 120 genes that are part of that comprehensive ataxia panel. So I use GeneDx for my panel. So GeneDx like that. GeneDx has a comprehensive ataxia panel with more than 100 something tests in that panel that I do it. Similarly, there is a movement disorder panel by some lab. There is dystonia panel. There is Parkinson panel, and so on and so forth. So I try to find the broadest panel possible, and I do that because that's a cheap way of doing it. So if you're looking for Friedreich ataxia and you do Friedreich ataxia gene, you might be able to get it done for $300 or $500. But what if it's absent and it's not Friedreich ataxia, and then you do the next ataxia testing, it'll be another $300, $500 or $800. If you do the whole panel with more than 100 genes in it, it's $1,000 or $900. So, only twice the cost or 3 times the cost, you can get more than hundreds of gene testing done. And our reliability of picking up one genetic test is very poor. There was actually a presentation, I believe in 2017, Movement Disorder Society meeting, MDS meeting. I believe it was in Canada, in Vancouver, the Movement Disorder Society meeting. There was a talk by Dr. Jinnah, Dr. Haider Jinnah. He's called Buzz, B-U-S-S, in Movement Disorders circle. So Buzz Jinnah or Haider Jinnah, H-Y-D-E-R, Jinnah, J-I-N-N-A-H, Jinnah. He gave a talk on movement disorders, one phenotype, multiple genes, one genotype, multiple phenotypes, one gene, multiple phenotype. So his point was that same gene can present with many different ways, and same presentation can be from many different genes. And the end of his talk, 20 minutes or 30-minute talk, was that it's very difficult to pick one gene for one patient to test, very poor accuracy. So it's better to just go for panels. And panels are cheaper, much cheaper than doing serial testing. You're doing 1, then 2, then 3, then 4. And there were studies he quoted where it showed that if you do one test at a time, it typically takes 3 to 5 tests to get to a right diagnosis in 50% of patient or 60% of patient. And if you do a panel, you get to the right diagnosis in 70% right away without having to go through multiple tests, when it's much cheaper. GeneDx is one company I use. Another favorite one of mine is the one in Vancouver. What is it called? Starts with an I. In Vancouver genetic testing company. Invitae. So Invitae is another good one. It's pretty cheap, relatively cheap, and have a lot of testing. GeneDx is as cheap as Invitae, but is much bigger panel. So GeneDx is now my favorite go-to lab. And for people outside of US, you can actually reach out to them and set up a way to send the blood sample to them. And it's pretty affordable, even in dollars. They might even give you more discount. So GeneDx, Invitae is another one. Now, for those in America and cost is not an issue, then APPNA is pretty good. APPNA has very good panel, APPNA Diagnostics. And Rush University lab is very good. Baylor University lab is very good for genetic testing. And Mayo Clinic lab, of course, is pretty decent in that order. So my first go-to is GeneDx, then Invitae, then APPNA, then I go to Rush or Baylor, and then lastly I look for Mayo Clinic for genetic testing. If I don't have it in-house, so University of Nebraska also has a lot of genetic testing available. If I cannot do it in-house, then another thing that is gradually coming up, I think GeneDx offer it, which is called whole genome sequencing, where if you're really not sure what you're dealing with, which panel to order, you can order the whole genome sequencing. They will test the whole genome and look for abnormalities. They can pick up bigger abnormalities like deletion, duplications, and things like that. They typically cannot pick up a single point mutation. So you can miss some abnormalities which are only single point mutation. There is only one change, not big shift. So your whole genome sequencing right now cannot pick up many of the diseases that have specific labs for them, specific tests for them. So that's why starting with panel is better. Although whole genome sequencing is pretty cheap now. I think at GeneDx it's $1,200 or $900, something like that. You can test the whole genome, but it only makes sense after doing the panel, because panels pick up single point mutations, small deletions, micro deletions, which whole genome sequencing will not pick up.